When the city took on the responsibility of funding its own health insurance plan, it also took on the responsibility of saving taxpayers and employees as much money as possible.
A self-funded health plan allows the city to provide health insurance directly to employees while paying providers directly for medical claims. It costs the city less money to do this, but comes with additional administrative work and additional risk.
Since 2020, Denver has used a self-funded plan through United Healthcare as one of its insurance options for employees. This is a common option for local and state governments across the country. However, recently I directed my audit team to take a closer look at how the city administers the plan to make sure it is getting the cost savings benefits it hoped for. We found city leaders need to keep a much closer eye on the eligibility of dependents receiving medical insurance benefits.
We found the Office of Human Resources was not following a city ordinance that requires it to recheck whether only eligible dependents of city employees are receiving city-funded health insurance benefits.
If ineligible people are on the city's self-funded plan, it would cost the city and the taxpayers more. Plus, individual employees would pay more through increased medical costs and premiums. One way the city could do more to keep costs down would be to check back in periodically to verify that dependents are still eligible for benefits. Over time, things like divorce or other life events could change eligibility. When we asked Human Resources why they never follow up after initial enrollment, they said the review would not be cost-effective and could harm employee morale. They also said the process of auditing dependents would be difficult to manage.
In the long run, ongoing eligibility checks help keep costs down. This process can be time-consuming, but it is a best practice.
Across the city's health plans, dependents make up more than half of all participants. At the time of our audit, Human Resources relied solely on employees to report changes in dependent status.
In 2018, an external auditor found nearly 14% of dependents on the city's plan were ineligible. That's about 6 percentage points higher than would normally be expected.
This shows a clear need for improvement. Both city ordinance and the principles of good management require the city to be thorough and accurate in its insurance oversight, regardless of how hard the work might be. Meanwhile, we also found the city needs to better review the work of its vendors that help assess and administer the health plan. Human Resources should monitor how effectively United Healthcare processes claims for employees. Ultimately, any higher cost caused by lack of oversight will land on City and County of Denver employees. Nobody wants to pay more for health insurance. I'm pleased that Human Resources is taking these opportunities for improvement seriously. Managers agreed to implement all 7 of our recommendations. In order for Denver to keep being a great place to work, thorough oversight and administration of the self-funded plan is essential. Well, that's it for this episode of Ask the Auditor. If you have a question, submit it to auditor@denvergov.org, and maybe yours will be the next one we answer on Ask the Auditor.